Aloha, welcome everyone to Hawaii Care Choices Healthcare Talk Story. I'm Tish Fukushima, your moderator this morning, and presenting today will be Lani Weigert, Community Relations Manager, and special guest Elena Cabatu, Director of Marketing for Hilo Medical Center. Before I start, I want to ask the audience, for those of you that can see and hear me, please put a thumbs up on your screen. Wonderful. Okay, we are coming in clear. For those of you on Facebook Live, aloha. We want to let you know that today's Zoom meeting is being recorded so that you and others may access it in the future. To our Zoom participants, if you have any questions at any time, you may use the chat feature. You may also utilize the Q&A box at the bottom of your screen if any questions arise for Lani or Elena. For those of you on Facebook, please use the comment box or to chat in questions. I'll be monitoring them as your questions come in. We are also doing polls today. Again, for those of you on Facebook, you will not be able to engage in the polls. However, if you want to join in the fully engaged Zoom presentation next month, please email me at lfukushima@hawaiicarechoices.org. So the polling is very simple. There's no right or wrong answers. A question will pop up in your screen. Please make the selection that you think is best and press submit. Right now, I would like to do a quick test and a little icebreaker that should be coming up now on your screen. All right, so the icebreaker on your screen right now, it says, would you rather travel to New Zealand, Paris, or Bali? I'm sure with all of everything that's going on in our world, a lot of people are thinking about their next dream vacation. I sure am, and being able to save for it as well. So it looks like we have a lot of people coming in. I am going to end the polling there and share the results. Mahalo for everyone. The results are 50% of you would like to go to New Zealand, 29% would rather go to Paris, and 21% would rather visit Bali. So great, that is all it was. I know everyone is super energetic already, had their coffee ready to go. Now I would like to introduce to you our speakers today. We have Lani Weigert, again, Community Relations Manager for Hawaii Care Choices. Aloha, Lani.
Aloha.
We also have special guest Elena Cabatu, Director of Marketing for Hilo Medical Center. Aloha, Elena.
Aloha.
Thank you for joining us this morning, Elena and Lani, and thank you for all of those that have joined this morning. Without further ado, I'd like to hand the virtual microphone right over to Lani.
Aloha, and thank you so much, Tish, for that. And welcome, Elena. Yay, Elena. Oh, I'm so glad that you're able to join us. So for everyone watching, I wanted to ask, are you or a loved one experiencing frequent pain or fatigue? Do you experience shortness of breath or struggle with anxiety and depression? Do you or someone that you love need support as a caregiver at home? If you answered yes to any of these, then I'm so glad you joined us today, because this entire presentation is really to provide support for all of you. So these are the three main programs that Hawaii Care Choices offers: palliative care, hospice care, and bereavement care. And I'm going to dive pretty deep into palliative and hospice care, just so that I could give you folks enough information so that you'll be able to make informed choices for yourselves in the future. And I'll lightly touch on bereavement care as well. So what is palliative care? First of all, I personally don't even use the word palliative, and I'm sure most of you don't either. What is palliative care? Well, to palliate is to ease, alleviate, relieve, and soothe. It's a very specialized type of care, and it is a program that is a pre-hospice program. So many people are living quite active lives when they pursue palliative care. So patients with serious or life-limiting illnesses will go into palliative care. Illnesses such as cancer, congestive heart failure, COPD, and even kidney failure will try to come into palliative care and ease some of their symptoms. And really, it's all about relief. The difference between palliative care and hospice care is all about relief. And really, the reason somebody comes into palliative care is to boost their quality of life. So who is appropriate for palliative care? First of all, for our program, anyone that's dealing with serious illness, such as any type of cancer, any stage, congestive heart failure, COPD, and advanced kidney disease as well. Patients can be of any age. We even treat children as well. And people can continue to receive their treatments, whatever those may be, dialysis, chemotherapy, etc. And then people do not have to have a terminal diagnosis. In other words, in order to come into palliative care, once you are diagnosed with a serious illness, then you're pretty much coming our way. Take it away, Tish.
All right, there we go. One brain teaser. The goal of palliative care is to improve the quality of life for their patient and their families. True or false? All right, everybody is inputting their answers already. Such quick learners we have today. I appreciate you all. Okay, just a few more. All right, I'm going to end the polling here and share the results. So the goal of palliative care is to improve the quality of life for patients and their families. 100% of you said true. Mahalo for joining our polls. Back to you, Lani.
Thank you, Tish. Mahalo to everyone. Oh, you're such a smart group. I'm so glad you folks are just great listeners. Thank you, thank you, thank you. Yes, palliative care, one of the main priorities of palliative care is to boost that quality of life. So the signs that palliative care is needed. These are physical signs, meaning you don't have to have a clinical background to know about these signs. But basically, if you or a loved one tends to be going to the hospital quite a bit, or going to your doctor, or even calling your doctor a lot, having a difficult time dealing or managing the medications because there's so many now. And largely that happens because the way that the medical services come to us oftentimes are siloed, which means that when somebody goes to their primary care physician, they may be getting their medication there. But if they go to one of their specialists, such as a cardiologist, they may be getting more medication there. And then if they happen to have some type of event and they have to go to the emergency room, they again get more medication there. Before you know it, it starts to become quite overwhelming. And so it's difficult to manage the medications. Diminished activities of daily living. What is that? That is basically managing your finances, just driving, basic activities that you do every day. And then you probably don't even think about going grocery shopping. And then all of a sudden you find out that you don't know why you're there. I mean, that even happens to me, so that might not be anything. But, having a hard time doing light housework or even making a meal for oneself is difficult. And then, of course, just the chronic feeling of pain, fatigue, even swelling in the feet and legs, and feeling nauseated as well. These are signs that you or your loved one may definitely need palliative care. So when should palliative care begin? Most doctors that we talk to, particularly our medical director, Dr. Dolan, she largely suggests and recommends that people come into palliative care at time of diagnosis. So when they find out that they have a certain type of illness, then they should definitely call us. And then throughout the course of the illness, somebody could be on palliative care. Now, palliative care is an umbrella to a subset called hospice care. So when people continue to progress in their disease journey, oftentimes they will transition over to hospice care. But initially, palliative care can really be with somebody for weeks, months, if not years. And those with serious medical issues really, we find, tend to live a bit longer, largely because we're able to manage their stress and their anxiety. So what to expect when you sign up for palliative care? Well, now, especially during COVID, we are able to visit you at home. So you don't have to come to an office to see us. We'll come and see you at home. And we'll also visit your caregiver and family members who are there to care for you as well, and then provide education for them. So besides coming in and finding out quickly about the health and medical history of the patient, we really, really are there to find out what is the patient's biggest concerns. What are their goals? That's the most important thing for us so that we can create a plan of care. The type of goals I'm talking about are life goals. Like we may go to someone's home who will say, well, my goal is that I really want to see my grandson graduate in June, or I really want to go on the family vacation to Disneyland with all of my family, or something as simple or as small as I just want to be able to get off the sofa and walk down to the mailbox and get the mail and come back without being completely breathless. And so these are types of goals that we'll actually write into the plan of care. And since these goals belong to the patient, we're as motivated for them as they will be for themselves. So medication review is part of something that happens on palliative care. Besides coming to the home, we're actually helping the patient and the family with their medication review, helping them fill up their pill minder box that is there in the photo, and also navigating through all of this medication. Because as I told you, oftentimes there'll be several different places that we are getting our medication from. And then before you know it, you start to become confused as to what to take. We find once we come on the scene and we're able to take an inventory of all the medication that's at one's home, we call the primary care physician and then put that person in charge of the team and the care of the patient so that that person can say, you know what, instead of the 27 jars of medications that they're taking now, they don't need 8 of those medications. Put them on the side, and these are the medications that will help them. We find that even after just doing that, 5% of the symptoms or discomfort that they're dealing with immediately just melt away. So how does palliative care work? Basically, I tell you that we go to the home, but really when we come to the home and create the plan of care for the patient, we immediately try to get to manage their pain and symptom control. So, if there's any kind of discomfort, we want to get on that right away. We want to also help them with their care coordination because most of the patients that we're seeing at home are seeing more than one doctor. And so that becomes quite overwhelming at times. And so it's really great to be able to help them line up all of their different visits and then try to coordinate them as well. Oftentimes, there are other medical insurance programs that they could sign up for, but they do not either have the wherewithal or they haven't had the time, and our social worker is able to help them with that. Say someone has Medicare, would also benefit from having Medicaid as well. We're able to help them navigate through that. And then, of course, getting the all-important advanced healthcare directives, we can help with that as well. And spiritual care can come to the home if that is needed. There is so much going on with palliative care. And so many people think, wow, well, how am I going to pay for that? For the most part, Medicare will pay for most of it. And there could be a copay depending on what other insurance a patient has. The copay could range anywhere from $20 to $40 when the nurse practitioner or the licensed social worker visits the home. Other than that, all of the other visits from the registered nurse, spiritual counselor, and volunteers are all included in the services. So now I'm going to transition over to hospice care. So just to recap with regard to palliative care, remember now, palliative care really is a focus on providing relief of symptoms. People do not have to stop their treatments. We will come in and help them manage all of that discomfort or pain that they may be dealing with. That is what palliative care does. Again, to ease, to alleviate, to soothe, to relieve. That's what palliative care does. Now for hospice care has a very different set of philosophies. First of all, hospice care comes in and we treat the whole person. It isn't about focusing on the disease. It's really about providing ultimate comfort for the person and their family. It really, again, focuses on quality of life versus quantity of life. And that's the difference with regard to having someone that is doing treatments. Oftentimes they're doing treatments so that they can extend their life. But when it comes to hospice care, it's all about the quality of life. And really, hospice care was created to ease terminal suffering and to help with emotional and spiritual stress. Many times it's probably the hardest time for a patient and family to go through. Again, the focus with hospice care is always going to be on comfort. What is hospice care? Hospice care is, first of all, provided by a team for those who are terminally ill. That's for those who have received a diet or prognosis of 6 months or less to live. For us, we find that that's just a number. Many times people will come to us and then find out that they end up living quite a lot longer than that. And of course, hospice provides a lot of comfort and support for the patients. In fact, I remember when my mother's doctor said that she could have hospice care. And we knew that my mom, who was at that time a stoic, pure Hawaiian woman, she was not going to have hospice care. In fact, when I went home to tell her, I said, "Mom, guess what? The doctor said you can have hospice care." She just said, "Oh, I don't need that hospice care. That's a terrible word. I didn't even know why you came home and told me about it. I don't even like that word hospice." I said, "Oh, okay, Mom. So you're not about hospice at all then?" No, I don't want any of that. I don't need that. I'm going to live a long time." I said, "Oh, okay. Well, I mean, I heard that we could get free stuff." "Oh, like what?" I said, "Well, brother's already paying for the wheelchair and other things probably that you'll need, in the future. And I understand it's already included in the program." She goes, "Oh, well, who's paying for that?" I said, "It's covered by your Medicare." "Oh, the government? Oh, no, I'm sure that's some kind of gimmick." I said, "Well, you know what, Mom, if I find out that it is included, what do you think?" "Oh, well, if we can save money, we certainly should do that." So I said, "Okay, so let me go find out." Well, of course, I mean, it was all included, which the doctor had told me. And I was unfamiliar at that time with hospice. And so I went ahead and contacted hospice, which was so easy. And before he knew it, all of these different goodies came into my mom's house. She had the hospital bed, the oxygen, she had the toilet seat, she had all kinds, she had the walker, the wheelchair, everything. It was amazing. She could not believe it as well. And there was a whole team that came with that, a social worker, the registered nurse. We had grief counselors come. We had volunteers. We had the we had the nurse that came, the nurse practitioner. We had so many different team members that came that my mom absolutely adored them. Even the home health aide that taught us how to turn mom in the bed and to give her a sponge bath and other things that we were not raised to just know how to do that. And as time went on, of course, she lived well past 6 months, largely, and we felt because of the loving and intentioned care that hospice gave her. She reflected to me that when my father had passed away from congestive heart failure, his doctor did not say to us that it was time for hospice for him, so we did not know. And his only wish was for us to have him at home to be with us when he passed. Well, sadly, when he had an event and couldn't breathe, we called 911 and he went to the hospital. By the time we got there, he had already passed. So when my mom reflected on that and said, "Oh, I really wish daddy had hospice care too," we understood now that she really did understand the wonderful benefits that hospice provided. And then she told me, "Well, you go out now to all of our neighbors and you go tell them about this hospice, because I know they're not going to know, and they won't know that it's free and included in their Medicare." I said, "I think that's a great idea, Mom, but I think right now it would be kind of awkward for me to just go into the neighborhood and start telling people who have no idea why I would be telling them that." And so she said, "Yeah, okay, I get it. Well, you figure out how you can go about it and go and tell these people about this hospice care, how wonderful they've been to me and my family." And I said, "Okay." And of course, 10 years later, here I am going out and explaining to everyone about the wonderful benefits that they provide, not because it's my job, but because it was a promise to my mom. Who qualifies for hospice care? Okay, so somebody who has the prognosis from their primary care physician that they have 6 months guesstimate months to live. Like I said, my mother went well past that. Someone who is suffering from terminal illness, which could be a plethora of different types of illnesses, not just the four that I mentioned in palliative care. And someone who is no longer seeking curative treatment, but really just wants to seek comfort and be with their families and spend that time as quality time at home. Oh, time for a brain teaser.
There's that bell. All right, round 2 of brain teasers. So up on your screen, there's a question that asks, hospice is where you go in your last days. True or false? Lani, I'd just like to thank you so much for sharing your story with everyone.
Oh, I wouldn't imagine going through this without telling them my personal stories. I absolutely adore the fact that my mom did her conversation with me the way that she did, unbeknownst to me at that time that, we were having the conversation.
Yes, truly. Oh, all right. Well, looks like we have most of the people coming in. I'm going to give a few more seconds. Again, the question is, hospice is where you go in your last days. True or false? Oh, someone chatted in. Great story, Lani. Lovely way to honor her memory and legacy.
Thank you so much, Hope. Appreciate that.
All right, I'm going to share the results. And 28% of you said true and 72% of you said false. Thanks for joining in on our polls.
Thank you so much, you folks, for responding that way. It's good for me to understand that there are people in the audience that would like some clarification on when it's time to call hospice. When I was growing up, amongst my family, it was pretty much clear to all of us that nobody calls hospice until the very final day. Meaning, if mom is looking good, then no, 2 more weeks, then we call hospice. We call hospice basically in the last 48 to 24 hours. But then once I became part of the program, I realized, oh my gosh, that couldn't be further from the truth. I found out that it wasn't just for the patient, trying to keep the patient comfortable during their last hours. In fact, we could extend that to not only hours, but weeks and months. And the fascinating part that I was able to experience is that the amount of support and help that we got as a family was unbelievable. And that could only happen if we called them early, which thank God we did. We had no idea that by calling them early, it would have made such a positive difference for us. But this is what we thought. And I know that this is a myth in many families. We thought, no, don't call hospice early, because if you call hospice early, it's going to hasten our loved one's death. And so we don't want to do that. We don't want to jinx it. So, myths are funny that way. And I'm so glad that everybody that's on the presentation is going to hear the truth now, that no, you don't want to call hospice in the final days. You want to call hospice as soon as your loved one qualifies to come in, because, oh my gosh, the goodies that the family receives along with your loved one is unbelievable. And the support and guidance, like I said, we would have no idea about how we turn mom in the bed, or giving her a bed bath, or being able to feed her when she no longer could come out of bed. All of those things, you're not born to know those things. Somebody needs to teach you. And thank goodness for hospice. They came to our house and taught us. And so when it was clear to us, for us, we were lucky because our doctor actually told us that mom was ready for hospice. But if he wasn't, and I happened to come to a presentation like this, I would be watching like, oh, is my loved one tending to go to the emergency room a lot, or having to call the doctor a lot? Does my loved one look like he or she is losing a lot of weight, and maybe is falling a lot, becoming a lot more frail than normally? And I tell you, and I don't know if it's just in local homes, but the making small of any type of fall or illness, or like, oh, it's nothing, it's not, oh, you know what, I just slipped on the rug, or all of that, I want you to know, is all part of it. Okay, so when your loved one is saying, oh, no, it's just a small cough, it's no big deal, I want you to know those are all signs that they may need hospice. Okay, so that's just the smoke screen that they give us, because they were raised to believe it that way as well. So no, even when my mom used to tell me, oh, it's nothing, just close the window, it was just a little chill, it was nothing. After a while, we started to recognize all of these different things that's listed here. And then we knew that we made the right decision by calling hospice. So how does hospice care work? Well, first of all, the wonderful team gets to come to your home. And, if you're anything like us, we hate when strangers come over. My mom would be somebody that would clean the house before she had a cleaner come over. It was that kind of thing. So once they started to come over, it didn't take long for them to become family. And it was really wonderful to have that kind of support. So they came over to our house, they helped us with her medications, they actually showed us what to do if mom started having a lot of pain. And also, they let us know that we could keep her primary care physician if we wanted. But we never really needed to ever call her physician again, because the care that we were receiving at home was just so wonderful. So what happened is the team came over and they talked to my mom and us, and they wanted to know what was important to her. And what was important to her was being home with her family. And so they created a plan of care that really situated her in that kind of comfort. And it was all about what she wanted, what her choices were, and they honored every one of them. And then pretty much the plan was followed by everybody on the team that came to visit us.
All right, Hannah Ho, for the brain teaser, is that bell again. The question up on your screen is, my culture expects me to take care of my family with healthcare needs at home. Strongly agree, neutral, disagree, or strongly disagree. And just plug your answers in and click submit. We've got a lot of different answers there. So again, no right or wrong. Okay, I'm going to go ahead and end the poll there and share the results. So, my culture expects me to take care of my family with healthcare needs at home. Strongly agree was 12% of you said strongly agree, 53% said agreed, 18% are neutral, 12% disagree, and 6% strongly disagree. Thank you again for joining in on our polls. Back to you, Lani.
Thank you so much, Tish. Thank you again, everyone, for weighing in on that. It's really an interesting part for us to dive into. So let's do that. What happens with regard to taking care of a loved one? I mean, we were pretty much raised, definitely in my household, that you take care of your own. I've come across quite a few families where everybody is working in the home. And so it's really difficult to take care of mom or dad at home while you're working and you're raising a family. So we find that, and now that I know, having my mom be in hospice, is that you really do want the experts to come in and take care of your loved one, not actually get in the way, and just because somebody told you, you should be doing that, and you are shaming the family by not caring for your loved one. There could be nothing further from the truth. It would be such a wonderful gift for not only your loved one, but for you and your family to have the experts come in and take care of your loved ones. So who qualifies for inpatient care? Now, I don't know how many of you even know that we have a inpatient care facility in the community, but this is like having an intensive care unit for the community in the community. So there are times when there are symptoms that we cannot manage at home. We just simply can't manage them at home. And so we can bring our loved one to Puhay Malama Care Center here, that's right in the middle of town on Kapi'olani Street. So once we are able to manage the symptoms, then your loved one is able to go home. I'd have to say, though, probably 98% of those who come to visit here and stay here normally pass here. And that's because they are already in the place where they're actively passing. And so by the time that they come here, they are able to be comforted, and then they pass with their families all around them. Normally the stay here is very short. This is not like a long-term care facility. People are here maybe on an average 14 days. And the difference on this is that although somebody needs to be under hospice care covered by Medicare, their room and board is not covered by Medicare. So normally those who have a second insurance, such as Medicaid, will have that covered under their room and board as well. So how is hospice care paid for? Pretty much what the wonderful news was to us was that 100% of the hospice care at home was covered under mom's Medicare. I mean, we're completely blown away. Any of the medications that were needed to keep her comfortable, etc., all of it, all of the equipment, all of it was covered. And it is also covered under other insurances as well, Kaiser and Veterans Administration, Medicaid as well. So again, hospice at home is 100% covered. If somebody needs to go outside to a facility for any reason, room and board is normally not included unless they have Medicare and Medicaid as well. So the beauty of our team is that we rounded up with these trained volunteers, and they come into the home and they pretty much become an instant friend to the patient and the family as well. They play music together, they read, or sometimes people will take their patient on just car rides to the beach because maybe they were, an avid fisherman, or or maybe they're a farmer or other things. And it really is a beautiful union with our volunteers. And our volunteers will come in and help the caregiver too, throw a load of laundry in the wash, or make a snack or sandwich for the patient. The reason that our volunteer comes is really to ensure that the caregiver feels supported every single week. In fact, Tish, one of the examples of a caregiver coming over, you mentioned something about folding clothes too, huh?
Yes, yes, they do. And the volunteers are so eager to help in any way, like you said, with the patient or whether it's the caregiver. So, yes, if folding clothes is needed, they will definitely do it. And I'm very thankful for all of them.
Thank you, Tish. I'm just going to round this out now with what bereavement care is. So, a lot of times when people are reluctant to sign up for hospice care, this is what I tell people. And the reason they're reluctant to sign up for hospice care is because they believe hospice equals death, and so they're afraid of hospice. But I tell you, all of us are going to pass at some point. So let's just look at it as a level of service. So maybe, some of us are going to go on this flight. In fact, all of us will go on a flight on Heaven Airlines, and our destination is already determined. So some will go at 12 noon, some will go at 2 p.m., some will go at 6 o'clock in the evening, but make no mistake, we'll all go. For all of those who are in hospice care and their families, they will go directly to the first class cabin. And the reason they'll go to the first class cabin is because that's where all the comfort resides for the entire trip, all the way to the final bridge. For everyone else that's boarding that flight, they won't go to the coach class of the plane, which is in the middle of the plane. They'll actually go to the baggage compartment of the plane. And the reason they'll go there is because that is the roughest, the most horrific, coldest ride to the end. And they will take all their family with them. Now, that flight actually turns around and comes back. And all the family that didn't cross over the bridge with their loved one returns. And many that return from that horrific ride are broken into a million pieces. For those with hospice care, they will have 13 months of bereavement care to help pull them together again, to help build their resilience on how to deal with life now without their loved one. And so I tell you that the Cadillac of services is definitely on hospice care, and bereavement care is part of that package. We also have community bereavement care too, or support groups where people can join us on Zoom and be a part of the support group talk that happens every week for free on Tuesdays at 10:30. So for those who need bereavement care, we're so happy and honored to be able to offer that as well. And so here's our mission. And for some of you who might not know where we provide services, there are two other hospices on this island. One is in North Hawaii and another one is in Kona. All the areas on this map that are in color are all the areas that we cover, that we provide services to, that we will go to the homes and help as well. So just to know, we are from Lapahoihoi Point all the way to South Point. So we're right there in Ka'u and helping that family as well. And now this is just information on how to contact us. But what is so exciting to me is my very, very special guest that has just been standing by so very patiently is able to now be a part of the presentation, since I just wanted to let you folks know at least enough information about palliative and hospice care. And I really hope I gave you enough without overwhelming you, because by all means, there's a lot of information. But I want to hand it back over to Tish. So Tish, you can help us bring in Elena with the questions that you've already received.
Mahalo, Lani, for sharing all of that information. Again, someone chatted in that the analogy of the services, hospice gives is perfect. So thank you again for sharing your story. All right, Elena, we have a really, really burning question. Can you please update us on the vaccine rollout? Which groups are currently being vaccinated, and when will the next group be expected to begin?
Aloha, and thanks for having me. Hilo Medical Center is a huge supporter of Hawaii Care Choices. In fact, our CEO, Dan Brinkman, is one of your board members, and we have long supported Hawaii Care Choices, and see Julia, one of your nurses that come in on the daily here and helps out so many families. So thanks for having me. Yes, so we've been vaccinating folks here since December 23rd. That started off with our employees. At the moment, we are at 70% of our employees have been vaccinated. Currently we have given about upwards of 6,000 doses to not only our employees, community healthcare providers, including many from Hawaii Care Choices and other partner agencies that are on the front lines. And then right now we are vaccinating 75 years and older, that group. It looks like we're going to be with this group for another 4 to 6 weeks at a minimum. So, all those folks who are eager to get their vaccine, who are 65 and older, all we are doing is asking them to please hold on. We will get to you, and we are trying to work as best as we can with what we have.
Wonderful. Thank you for that update, Elena. Can you please share updates on the protocols for patients and their visitors at the hospital and at all East Hawaii clinics right now?
Yeah, so visitation at the hospital has expanded from no visitors to 1 visitor, and now we're at 2 visitors per day, 1 at a time, from 3 p.m. to 7 p.m. Those are just visitors that we will allow to come in. You have to get screened at the front. So we have a line form at about 3 o'clock, and folks come in for their visit, and you can stay for the duration if the second visitor wants to come in. So you'll have to swap in and out. At our clinics, it's 1 visitor or 1 caregiver with them if they have needs of, they need to be walked in, or they need translation, or they just need company in terms of our oncology visits.
Right. Speaking of oncology visits, are there any updates regarding the oncology cancer clinics operations now and in the future?
Mm-hmm. So if you drive by the hospital today, or the cancer center, it is now under the umbrella of East Hawaii Health Clinics. You will see construction going on across the street, and it's about a $15 million project that's allowing us to expand the oncology building that also houses other specialty clinics upstairs. So for oncology, it's gonna allow us more elbow room for our oncology patients, medical oncology patients getting their infusions. Right now, as many of us know, it's very tight in the current infusion area, and it makes for very close quarters. We want to give not only the patients, but also the staff more elbow room to breathe and to receive great care. I see Lisa Rance is on here with us. She's the Hilo Medical Center Foundation, and we're working very closely to bring a lot of creature comforts to patients receiving care there. And so we look forward to the completion of this project. We will see when it'll be completed. I know it's been a long time coming, and it's been we've enjoyed a lot of support from the community and legislative support as well.
That is wonderful. Good positive changes. Another question is, how is the management transition going for Yukio Okutsu State Veterans Home? And what are the protocol changes for visitors?
So the Yukio Okutsu Veterans Home, State Veterans Home, is the only veterans home in the state, managed the State Veterans Home. The transition has gone beautifully. We have put some senior leadership in and structure in to help manage the Yukio Okutsu State Veterans Home. These are administrators from our Hilo Medical Center Extended Care, and also Haleho'ola Hamakua, the administrator there and the director of nursing there. There's part of a larger long-term care critical access leadership team that oversees not only Yukio, Hilo Medical Centers, Extended Care, Ka'u Hospital, and Haleho'ola Hamakua. So that structure put in place allows us to bring all the best practices that we have at our other facilities into Yukio Okutsu. And I think the feedback from the staff we've been hearing is just, you know, a sigh of relief, some hope, some healing. And this is just only the beginning of our path forward.
That sounds great. Thank you, Elena. Back to the vaccinations. A participant wants to clarify, I saw in the news that 65 and above date would possibly be March 1st. Is that still correct?
Well, it depends what news source that was, because that could be a news source on the mainland. It could be a news source on another island. But what we can tell you right now in Hawaii County, on our island, we are all the points of dispensary, all the pods are holding firm, holding the line. We have to get through the 75 and older group first before we can move on to 65 and above. Again, our best estimation, according to us receiving about 1,000 doses a week and giving out 1,000 doses a week, is that we are about 4 to 6 weeks out from getting to the 65 pluses. And the demand is so high, but the supply is so low, and it's trickling in. The good news is that it is coming in, at least. You know, has not been an interruption in supply. But you know, in the meantime, everyone get your own email addresses, pre-register on the Hilo Medical Center website. Then once we open it up to the next group, you will receive an email from the CDC where you can register on the VAMS website and then schedule your appointment. And I'm also working the helpline, so feel free to call it. And you know, it's a community helping out community as well. I've gone up and down my street to help the kupuna on my street and make sure that they have had assistance. And in fact, one even came to my house and brought cookies. You know? So I helped her schedule a second appointment. It's you know, we all got to do that for each other, especially those who don't have access to computers, those who don't have you know, aren't computer savvy. But this is the best way, because you can print up that certificate that says you have got both doses.
Great. It's so good to hear that everyone can also pre-register. So please go and do that as well, email addresses and such. Thank you, Elena. Another question, does large monetary fines against the facility impact HHSC, or does that get directed to the previous management company? And a two-part question is, can you explain what HHSC stands for?
Well, I'll start with that for the second question. HHSC stands for Hawaii Health Systems Corporation, and it was formed in 1996, in which it brought all of the county hospitals under the state umbrella. So there was that management structure that was put into place to have, you know, big buying power, you know, state employment, all that good stuff. Since then, though, we have brought back the management to the local level. So if you look at our board members, you'll see them from the East Hawaii region. And we have leaders in our community making decisions that benefit our greater community at the hospital. So wherever you see our priorities go, that is really the community's priorities coming to life. As far as the news last Friday at 5 o'clock that came out about that large fine, over $500,000, that will be paid out of funds that had been transferred back to us from the veterans home, from their management of it through Avalon Healthcare. So that will be paid out of that bucket of money. I would like to say that, the media was very good at saying that it was incurred during the last management company's watch, but we are moving forward, and Kawi Chartrand is at the helm there. She is also started there as a assistant social worker. So it's come full circle. There are still some residents there that remember her, and that she remembers them. So it's a really good full circle story, and we have nothing but strong support for Kawi and the staff there.
Well, we appreciate that update on that, Elena. Question on support groups, such as COPD and rat lungworm, have been very successful. Do you continue this work during COVID-19?
COPD support group and rat lungworm, I ran those groups. COPD, as we all know, it's a chronic respiratory issue. And so, we had to stop seeing each other. A lot of them are not computer savvy. So doing a Zoom meeting with, 3 people was not that successful. So we had to stop that, put it on pause. Same with rat lungworm. In fact, rat lungworm, we have seen very little cases come in the hospital over the last year. I actually haven't heard of one case come through. But we put that on pause because actually half of the group, they don't live here anymore. They have moved on. The other participants are actually healthy enough, and they still struggle with the long-term effects of rat lungworm, but they've learned to live with it. But still keep up your precautions, wash your veggies. I know everyone's gardening these days. The other support group that I would like to mention that is still going on, though, is the stroke support group. They meet every second Tuesday of the month from 4 to 5 on Zoom, and you can get that information on our website under support groups.
Thank you so much, Elena. It's so nice to, have some support groups going on, but I know with everything going on, a lot of people had to just dive into the learning curve of technology. I mean, really, that's why we are gathering on Zoom today. So again, thank you for coming. Question is, which East Hawaii clinics are taking new patients now?
So last year we had transitioned all of our clinics, and we rebranded and renamed them under the East Hawaii Health Clinics. You hear our radio ads and you see the TV ads. They are all taking new patients. Some might have a little longer wait time than others to see the doctor, but they're all taking patients. These are clinics that range from our orthopedic, cardiology, vascular, oncology, nephrology, urology, ENT, and primary care. And just one note too is that we're opening up another primary care clinic in Ke'au. So it's East Hawaii Health Clinic in Ke'au. Our other clinic is in Pahoa at Puna Community Medical Center.
Wonderful. That's so nice to hear that all of them are taking new patients. A participant asks, I signed up for a shot in January. I'm in the 65 to 74 group and understand that I won't receive the shot for 4 to 6 weeks. How do I check to make sure my sign up was successful?
If you entered your unique email and your birth date correctly, we should be sending you regular emails with updates of not yet, but we'll get to you. You should receive that, or and then once we do have those slots, those appointments open, you will receive an email from the CDC.
Okay, great. Thank you for that. One more for the vaccination. Is there any approximate time frame for those under 65 to get the vaccination?
Again, we believe it's 4 to 6 weeks, but with LONGS, with KTA, with Bay Clinic coming online there's going to be on February 20th out in Ka'u with Bay Clinic. They're going to do a mini vaccination clinic of about 100 doses, I think, but they're going to have 2 other locations out that side. In Hilo, we're going to have a vaccination clinic for a megapod, we'll call it, that we're running. It'll have 2,000 doses that we're going to try to give out. But it's not an open to the public thing. This is sign up through your agency type of deal, so we can know exactly how many and who we're going to vaccinate. So we're still trying to get through the teachers. There's a lot of teachers out there, not just DOE teachers, preschool teachers, and private school teachers. So we'll get to them as soon as we'll get their second doses in 3 weeks, and then after that we'll start chipping away, and hopefully the supply of vaccine will come in, and we'll be able to open it up to the general public, and even the 65s before we get to the general public. But yeah, we're hoping for sustained and increased supply of vaccine.
All right, thank you. I just like to say all your efforts at Hilo and all the Hilo Medical Center staff, thank you for, I'm sure everyone's working overtime right now just to get everyone vaccinated. So I do appreciate all your efforts as well. Currently, there is no other questions. So I just like to thank everybody for attending today's Healthcare Talk story. Again, Elena, for all of your updates and perspectives. If you can stay on with us for a short while, I'm going to put up a 8-question survey for those of you joining our Zoom presentation. Again, for those on Facebook Live, you will not be able to engage, but please email me if you would like to join the fully engaged Zoom next month. So a survey will pop up on your screen in a short second. There are 8 questions. If you could please fill those out. They are anonymous and the results will not be shown, unlike the poll party. We would love to get your feedback on our presentation today for all of you who have joined. Your input will allow us to gain a better understanding of how we can best serve the community and have these presentations and have wonderful guest speakers like Elena here. That should be up on your screen now. Okay, wonderful. And just a reminder, if you feel that you've benefited from this presentation, please let your friends and family know. They are welcome to join any 10th of every month at 10 a.m. Just RSVP to myself for a Zoom link. My email address is lfukushima@hawaiicarechoices.org, and I will write that in the chat. So Lani, I'm sure you have some questions for Elena as well.
Yes, thank you so much, Tish. Thank you, everyone, as well. And please continue filling out your survey while Elena and I are just talking story. So, Elena, I just wanted to ask, the person on the news that made the comment regarding the 65 plus people able to get their vaccine was Josh Green. He said that there would be more vaccines coming in March 1st. And I totally get it that Oahu doesn't drive the rest of the state. So I wanted to know how much vaccines does the hospital get every week?
So every week we get 1 tray of Pfizer vaccine, and that amounts to just about 1,000 vaccines.
Okay. Mm-hmm. Okay. So did they say that they're probably going to up the amount of your vaccines or no?
I just was on a call this morning, and there is no indication that our supply is going to increase. And in the near future. We keep on hearing about it on the national news that production's ramping up, but you know, we just have to be, you know, err on the side of managing our expectations here and be grateful that our supply is steady, even though it's a trickle, but it's still a huge task to get out 1,000 vaccines a week, and we have to hire more staff. I don't do much else other than work the helpline, you know, throughout the day, and so it does take a while on the helpline because we're walking folks through the process of registering. Sometimes they have to come to the hospital because they can't hear, or you know, they're having problems with their emails, and we just can't get to that one screen. So we just got to be patient, and we just got to, you know, just sit tight and stay careful and continue to observe precautions.
Well, I think Hilo Medical Center has done an incredible job. I mean, if you watch national TV on these long lines, or where they have the kupuna out in the parking lot in the sun or in the cold, I just cannot even imagine. And Hilo Medical Center, oh, so organized. I just love it. I just love it. So kudos to you guys. I mean, we feel super honored to be a collaborator with Hilo Medical Center. I mean, you guys rock a big one. Tell me now about these megapods, and I'm sure that, you know, the way information is coming to you is sort of here and there, but on the megapods, the people that will come to that, are those the people that are on your hospital waiting list, or is that a whole nother group of people?
So we're working directly with the Department of Education and other entities that are on the front lines to get their list, to pre-register them. Our megapod is only going to be by appointment only. But we do want to let you guys know it's happening, you know, but it's not open to the public per se. We will get there. It's just the first few pods, megapods that we're going to be putting on has to be targeted, because we cannot move on to the next group until we get these groups vaccinated. And most people understand that, and I'm really grateful that they do. And it's hard to tell someone, oh, just wait a little while. The other question that we get on a lot is, well, I have all these comorbidities, I should qualify, you know, or I'm a caregiver. At this point, we have so many 75 pluses out there that want the vaccine. We have to stick to the age group only. And, you know, it just breaks my heart, you know, to say like, well, you know, Mrs. Fukushima or whatever, or, you know, Okimoto or whatever, like, you know, you don't turn 75 until the end of the month. So we're going to have to just either wait or, you know, schedule you on your birthday. But it's hard because we really, you know, people have valid cases out there to get the vaccine, but we just can't at this point, and we're going to have to stick to 75 pluses.
So the teachers and all of the preschool teachers, which love you guys that you remember to include them, they are in the 1B category as well? They are. Awesome.
We need to get them vaccinated. We're seeing kids go back to school slowly but surely, thank goodness. But we do need to get them vaccinated. And so we're working with the principals, we're working with with Chad Farias, and we're just trying to make sure that the teachers get vaccinated, and other healthcare workers that maybe have been on the fence and they're ready to say, okay, I'm ready to take the shot. So, you know, I hear a lot of concern too for bus drivers and other folks who are coming online per se, you know, to help bus the kids to school even. So, it's really hard triaging the priority groups, but we're trying to do it as methodically as possible. In fact, tonight we have our regular Wednesday call with all the people giving out vaccines. So all of the point of dispensing folks meet every Wednesdays to talk about, okay, where are we at? You know, what's your supply looking like? And we are moving forward together as an island, and that's really helpful because it would be very difficult if one pod took 65s. So we're trying to hold the line.
Yeah, that's excellent. Tish, you had a question?
Yes, I did. A question about vaccinations in the Keao area.
Let's see. The Keao area. I do not believe there is a point of dispensary in Keao. Right now, Bay Clinic is doing it in Hilo. There's 2 Department of Health locations on Wednesdays and Thursdays. However, I do believe their appointments have been taken up for the rest of the month. And then I saw that Bay Clinic didn't have appointments. So I think all of the vaccines that everyone currently has are spoken for. What we're trying to do is make sure that we have vaccines for appointment slots. Now, you've seen on the news on the mainland, or even in the state, they've planned for mass vax pods, and they had to just either cancel the appointment or turn people away. That's not what we're interested in doing here as an island, trying to give out vaccines. We want to make sure that there's vaccines for appointments.
Okay, great. I have another question going back to those who have pre-registered. If they are receiving their emails, they should feel safe. But another, question is any other way to check if 100% sure? We don't want to get out of line here.
Right. You can email us at HMC COVID vaccine. I'll put up the link or the email address in the chat box. Let me see real quick. Oh, here it is.
I think that would be really helpful. Thank you for that.
Oh, sure.
All right, and while Elena is getting that link, I just want to say mahalo for all of those who have joined this morning. Thank you so much for taking that survey and giving your input so that we can just improve these presentations in the future. I want to shout out to all of our volunteers who have joined this. So mahalo to all of the volunteers for Hawaii Care Choices. Lani, thank you for your time and all of your efforts, your stories. A lot of people chatted in. Thank you for sharing all of your stories of your ohana this morning. And Elena, again, thank you just for being here and all of your information and updates. I know a lot of our attendees did get a lot of information. So thank you so much for that email in the chat box. I hope all of you can see that. HMC COVID vaccine at hhsc.org. Perfect. All right, Lani, do you have any last remarks?
No, I just would like to thank everyone for providing us the honor and the privilege of having this time with you. And I hope if there's anything we can do to support you, please do not hesitate to contact us. Mahalo, everyone, for joining us today.
Yes.
And mahalo, of course, to Elena. Yay, Elena.
Thanks for inviting me, and aloha, and just keep on being safe, and we'll get out of this all together and as a stronger community.
Mahalo. Aloha, everyone.